Oh, baloney. The whole thing always gets back to drugs.
Hello, my name is Sandro Graca and I'm a licensed acupuncturist. By now you know that we have this amazing event coming up here in Dublin, which will be the first time ever that we will have a full dedicated weekend seminar on research and evidence in Chinese medicine and acupuncture. This will be with Dr. Barzilay, and we are so privileged to have the opportunity of running this course in Ireland. And I can tell you now that there's actually people coming from other parts of Europe to attend this course. So this is going to be pretty special. On the other side of the line, I have Dr. Barzilay waiting to come online and tell you exactly what you can expect. So he's going to give you a little bit of a preview. I think he actually put some slides together, so it's going to be really like here's a taster of what you can expect from the whole weekend. Without any further ado, let's go to the other side of the line and go to split screen to see what Dr. Barzilay has to tell us about this amazing course. I believe you have a little bit of a preview for us, so you can give us a little bit of a taster of what to expect.
Exactly. So that's the purpose of this short call, is really to give a taste of what is going to be presented and shared and discussed with the attendants over the weekend. First and foremost, like you said, this is not a course in research. No one's going to come out with the ability to conduct research or to do a degree in research. The whole idea is to give a real pragmatic tool for therapists to discuss research with their patients, with colleagues, with politicians, if that's what they need in their own countries, with whoever. So just to be able to look for it, understand it, and be able to talk about it. And that's what I'm going to try and explain in a little bit in the next few slides. So the first slide actually shows what I believe in is that research is really part of our toolbox as therapists. We, of course, study whatever we study, TCM, and on top of it, Qigong or Tai Chi and Shiatsu or any other additional techniques and tools in our toolbox. But at the end of the day, what makes us a little bit different from Western medicine is that we spend a lot of time with our patients. And when they're lying on the bed or on the chair, they actually ask a lot of questions for themselves, to try and understand what we're actually doing to them and why it is or not working for them. And also for their friends, relatives, whatever, wondering whether this works for that disease or another symptom. And I forgot to say, here's another thing that I'm suffering from and stuff like that. So all of these questions come up during the half hour or 1 hour, however many minutes you spend with your patients. And that means that we need to be able to answer questions. Just talking about the fact that it's an ancient medicine is great, but people read the headlines, read the newspapers every day. And to be honest with you, when you look at this or the last few years in the next slide, you can see that we still have a lot of skeptics. You can see there acupuncture is a theatrical placebo. You can see the definition from Wikipedia, and whether we like it or not, Wikipedia is the most important or relevant or used, I think. Just like Dr. Google, it is the most used encyclopedia. And so people actually go and look for what is acupuncture. And what they'll find is that it's not based on anything, and it's pseudoscience. And you see all these other articles that some of them are nastier than others, but these are questions. Some of them are good questions on whether acupuncture works and why does it work. And so we need to provide these answers to them. I can't say that everything is bad, because if you look on the next slide, there's a lot of news, good news as well. And I think it's slide number 4. And the good news mean that, again, we get a lot of questions, this time maybe from a positive point of view, but we do get a lot of questions. For example, with the opioid crisis that is making headlines everywhere around the world, and especially in the US, people hear that cognitive behavioral therapy or acupuncture or other techniques are good to come off and to treat their pain in the right way, but they want to know how does it work. Why should acupuncture work for them in treating their own pain, or even on for coming out of the opioids that they have been using. When Angelina Jolie, for example, talks about her Bell's palsy, you could see the statistics for Google search. A lot of people didn't know what Bell's palsy is, And certainly that acupuncture works for it. Now, in Western medicine, hardly anything works for Bell's palsy. We know it as therapists, but most of the population doesn't know. So they don't know what Bell's palsy is. They don't know what she suffered from. She looks great on this photo, but she talks about the fact that acupuncture helped her. And that means that patients will be asking about this.
Yeah.
We'll be asking about other diseases. We'll be asking about why should it work for that? That seems like a neurological issue. That's something that happens with the face. Why should it work? So, like it or not, we have to talk to our patients. We can talk about the holistic therapy and the mind, body, and everything. That's great. It should happen. Why people should adopt better nutrition, lifestyle, etc. But when they want to know why and how does it work, and does it work for cancer, for other types of pain that they've not been, never knew that it may work for, they want to know, and that's why we need to work. We need to talk about research. So that's the whole purpose of this course.
Yeah, and just to say there, that's part of the reason why, with the support from the evidence-based acupuncture to actually put this event together and getting someone like you to come over and do this. And now we're seeing that this is not just going to be for Irish practitioners, because there's others coming in as well. That is a very key point. So you're talking about not only, it's that distinction between not only being able to talk to the patients, but actually, and that's going to be kind of like one type of language, but then knowing how to talk to the other professionals as well, because you're not going to use the same language. Let's be realistic. You're not going to use the same language if you're talking to, say, a GP, but you actually want to have that tool in your box as well, because if you want the GP to refer the patient to you because of Bell's palsy, you kind of need to know what are the studies out there, what is the evidence supporting that, because you can't be using the same language about mind, body, and spirit and all that. That might be appropriate for the patient, but not really for the clinician.
That's true. Yeah. And so that's kind of the first part of the first day, where we'll be talking about the need and giving a lot of examples of where the situation where we are, because we have to face the reality. It's not that I read and write and talk about research all the time, but it's those type of patients, or our type of patients, who do need this type of evidence. And it is the colleagues, and it is the politicians, the lobbying that you do as associations around Europe, trying to advance TCM into a common practice, that you need to discuss these things, because that's the first thing that they will ask. So
yeah, I really like that analogy of the toolbox. That really makes sense, to me. So I hope that the message goes out to everyone as well, that it is another tool on your tool. It doesn't mean that you're going to be spending the rest of your life now reading about research, but it's a handy tool to have there to be able to communicate. So it's great.
Yeah.
Listen, thank you so much for your time. I'm going to, the link has been down here. People can go and check it out. It's been on social media as well. Thank you for sharing it. It's great that that people, as you know, people from other places are seeing it too. So that's good. So the message is getting out there. And what can I say? I'm looking forward to it. So thank you so much for your time.
All right. Talk soon.
Thank you. Bye-bye.
Bye-bye.
Oh, baloney. The whole thing always gets back to drugs.